Hello and welcome to another session of Doc Talk with Dr. Russell Jaffe, owner, founder of Perk Integrative Health, and medical anthropologist and bone health expert, Dr. Susan Brown. And I am Jay Srimani, clinical nutritionist with Perk Integrative Health.
Dr. Jaffe, let's talk about calcium. There's so many interesting thoughts about calcium today. I really want to get your opinion. Number one is, as people who work with bone health and have studied calcium intake over the decades, I see now that our intakes are somewhat higher because so many foods are fortified, and also people are taking vitamin D, so they're getting better calcium absorption. And so I have one hand thinking, okay, we're getting a little bit more calcium. And then that's combined with the thought that calcium is really important to bone. So how do we decide on the optimum level of calcium supplementation? We're looking mainly at postmenopausal women. The government is saying take 1,200 milligrams of calcium between supplements and diet. You have other groups saying that, looking at the data, saying excess calcium. And certainly early on, decades ago, they gave very high doses of calcium, maybe 1,500 milligrams without magnesium, without vitamin K. And I think there's a reasonable argument that a certain percentage of people develop some hardening of the arteries from this. So I want your discussion of how do we decide the optimum intake of calcium for any individual in our society today?
Profoundly important question. Calcium is the activating mineral. Magnesium is the relaxing and soothing mineral.
Mm-hmm.
And the dilemma is that most people who supplement with calcium are taking forms of calcium that are contaminated with lead, mercury, arsenic, cadmium, and nickel. And therefore, the more you take, the worse it is. So if you go back to those classic studies, as I have, what you find is that Carl Pfeiffer was correct early on in pointing out that contaminated calcium should be avoided, and the forms of calcium that should be enriched are dietary and bioavailable recrystallized calcium salts, like potassium citrate, malate, fumarate, glycinate, etc. And so we have used magnesium citrate in some of our formulations. We have magnesium plus choline citrate available today and tomorrow, because there are several $1 billion a year in the United States of calcium channel blocker medications that are prescribed, and I'm giving you the numbers of the sales, so there's probably more prescribed than actually used.
Right.
And the reason is because we have a relative excess of calcium and an absolute deficiency of magnesium. So we suggest checking the first morning urine pH after rest, adjusting your intake of magnesium and choline citrate based on that first morning urine pH after rest, and getting most of your calcium from seeds and nuts and vegetables and fruits, whole foods, where you always get the uncontaminated minerals. So there are many efforts to fool the body, and they all end up fooling us. So you want to use an uncontaminated form of calcium with D3 and K2, plus enough D3 drops to get your blood level into the 50 to 80 nanogram per deciliter or per millimole range. And it's more than that. So you can actually find, as I'm sure you've seen, studies that say, we gave people calcium and we gave people vitamin D and very little happened. And the more we gave, actually, the less that happened. Well, why would you give, in retrospect now, in hindsight, which is always so much clearer, why would you give a contaminated form of calcium? Because they didn't know better. They ground up a rock. They didn't have ICP mass spec available. They didn't know how much lead and other toxic metals were present. So you have to actually get involved with the sources, the processing, and then the shelf life, because things can compete with each other on the shelf. And the bottom line is the super premium companies like Perk Integrated Health, like yourself, can guide people through these treacherous times. And what we do is we stop the bad stuff at the door, we enhance the ability to detoxify from the bad stuff that does get in, and we increase the amount of good stuff because the nutrients are necessary to deal with the anti-nutrients, which are the toxins.
So this association with arterial calcification,
No, wait, it wasn't arterial calcification. It was thickening of the carotid wall by Doppler ultrasound. And it turned out that the healthier people had thicker carotid walls. Now, when you talk about atherosclerosis, which is an advanced form of repair deficit hardening of the arteries, I have to ask why you've been in repair deficit for the last 30 plus years. Because it takes decades to accumulate ASHD, arteriosclerotic heart disease.
Right.
And as you know, Susan, when I was at NIH, we studied foxhound dogs and Yucatan miniature pigs in regard to cardiovascular disease. And what we found was that damaged fats, oxidized cholesterol, and oxidized LDL were profoundly toxic, but it didn't matter what your cholesterol or your triglycerides were. It didn't matter what your HDL or LDL were. It mattered whether you had enough antioxidants to deal with the pro-oxidative anti-nutrients. And others, over the last decades, have confirmed in people it's the same thing. So what we want is to get your repair, immune defense and repair system into repair mode so that plaque is debris that should have been recycled, by the way, that carotid plaque or that coronary plaque or that hardening of the arteries plaque is actually debris that a healthy immune defense and repair system would have recycled. The implication is that when you wake up the immune defense and repair system using the C-cleanse, using the magnesium choline citrate based on first morning urine pH, making sure they have enough omega-3 fats, making sure they have enough CoQ10. Now you have regression of the atherosclerotic plaque. So prevent it from forming, and if it does form, reverse it.
Right, okay. Yes, I see. The public has fallen into this trap of just thinking high dose calcium is either going to solve the problem or it's toxic, instead of going a little deeper to try to see what the full picture is.
Yes, we need to have more than one color in our palette to paint with or something like that.
Right.
The notion that more is better is a profoundly wrong notion.
Right,
It's always a Goldilocks scenario. Not too little, not too much, just right is just right. So find out according to your nature and your self-assessments and your predictive biomarkers interpreted to best outcome goal values, where you are along that continuum.
So what would be the best way to actually know whether you need to supplement with calcium? Is there a measure that we think is one or another?
That's a good question. And the answer, we do know the answer. The answer is ionized calcium in the blood.
The answer is ionized calcium blood level?
In the blood. Plasma ionized calcium.
Okay.
Plasma ionized calcium. Total calcium is complicated because it depends on your liver and your albumin and your this and your that. But ionized calcium is sufficiently sensitive and specific to tell you if you have enough, too little, or too much. And hyperparathyroidism does exist.
Hyperparathyroidism doesn't what?
Hyperparathyroidism does exist.
Oh, yes, exactly.
Absolutely.
You've seen, I'm sure you've seen a number of these, as Jayashri has. These are well-intended people who are walking around with too much parathyroid hormone, and their ionized calcium is too high.
Right.
Well, you need to address the parathyroid problem.
First. Right.
But it seems like the ionized calcium will not get extremely low because you'll take it out of bone. So
No, but that's a very good point. You first deplete the tissues, then you deplete the periosteum, and then eventually you deplete the bone. But as has been shown in studies of ionized calcium, when the ionized calcium goes below the lab range, you've already depleted the bone.
so what would be the ideal range? You don't want to wait till it gets very low, and that could be also lack of protein, lack of albumin. That's a kind of complicated story, isn't it, with the ionized calcium?
No. The reason you want ionized calcium is because it's the free calcium, it's the biologically active calcium, it's the calcium you need to know about, not the calcium that's bound to something other.
Right.
Not the calcium that's bound to albumin or insulin or globulins or this or that.
Okay.
So you absolutely always want the ionized calcium. And then you can use, if people are in the lower half of the ionized calcium range, they're marginal to deficient.
That's okay.
Yeah, so it's about 4.6, they say, 4.6 to 5.2.
Yes, and if you're in the lower half of that range, you're marginal to deficient. If you're in the upper half of that range, you're okay. It's very analogous to chronic latent magnesium deficiency, CLMD.
Now that's very interesting. Okay. That is very, so you would again look to see anything in the lower half suggests that probably more calcium would be useful, more dietary calcium, more supplemental calcium.
Or less toxic minerals.
Mm-hmm. Less toxic, yeah, that's always good.
Usually people have enough calcium, they just have their ion channel, their calcium, magnesium, ATPase ion channel is inhibited by the lead, mercury, cadmium, nickel, and arsenic in their diet.
That's
and
very...
When you remove it from the diet, you remove that burden. Now the ion channel can rehabilitate itself over time, over a few months. It's not 20 minutes, but very often we focus on the big rather than the meaningful. In this case, the big would be measuring ionized calcium and forgetting that the ion channel is very sensitive to some of these environmental contaminants.
That's a very important point. Yeah.
Yeah, that's an interesting point. Yeah. And so slowly we detoxify through changing our diet, through using antioxidants, all these sort of things.
You can reduce by 80% the amount of toxin you bring home just by changing some of your habits, like taking your shoes off and having outdoor clothes and indoor clothes. Then you have to have an air cleaner inside because every human being puts off about a half a pound of dead skin into the environment every day. And there's a lot of little critters that like to eat dead skin.
Oh my Lord.
So now you need a HEPA filter or an ULPA filter with an ionizer and a charcoal filter, or one of these new molecular ionizers that destroys, electrolytically decomposes the spore or the dander or whatever's in the air. I have both. And I think they're both good in certain circumstances. The individual needs to clean air and needs to bring more fresh air in, because as bad as the pollution is in the outdoor air, the indoor pollution is always worse than the outdoor pollution. So if you could live with open windows and doors, it would be better. But be careful of that in most urban environments.
Yes, that's a very good thought, that indoor pollution.
Yes, and this goes back to the early 80s when we did a report called Clean Your Room for the young governor, Jerry Brown, through the Consumer Affairs Department. And I'm glad to tell you it's still available as a PDF online, all 619 pages.
Clean your room, huh?
Clean your room.
Dr. Jaffe, what about the magnesium calcium ratio? We of course use the Perk product that has 500 calcium, 500 magnesium. I personally find in my work that people benefit from more magnesium. We generally end up using about 1,000 milligrams of magnesium, 500 calcium. Do you have any thought on that?
I can tell you personally that I take 1,320 milligrams of elemental magnesium as Mag Plus Guard with choline citrate.
Mm-hmm.
And without choline citrate, I would have loose stool.
Mm-hmm.
I think when in doubt, take more magnesium with choline citrate.
Right.
Yep. And you can always supplement the magnesium from what is there in the bone guard. You can
Oh,
always.
absolutely. And can have foods that have minerals in them, but healthy minerals. And then let your digestive microbiome sort some of these things.
Right.
It really knows what to do if you just give it the basics.
Huh.
Okay. Well, thank you.
Thank you.
That was great.